Male urinary catheterization. Exhibiting professional behavior. Before starting with this procedure, make sure to identify the patient correctly. Introduce yourself to the patient. Explain the procedure to the patient. And obtain informed consent from the patient. Prepare the tray that you will be using for the urinary catheterization. Open a packet of sterile gloves. Open the catheter bag, as well as the needle and syringe. Add KY jelly to a bowl. Pour a few milliliters of a hibitane in water solution over cotton wool swabs. You are now ready to commence with the procedure. Positioning the patient. Ask the patient to remove their clothing from the waist down. Alternatively, ask someone to assist you. Place a linen saver underneath the patient's buttocks. Position the patient supine with flexed knees and abducted thighs. Cover the patient until necessary to ensure privacy. Draping and cleaning the patient. The medical practitioner has to stand next to the right hip of the patient if they are right-handed, or on the patient's left side if the practitioner is left-handed. Wash your hands aseptically and put on sterile gloves. Fill the syringe with sterile water, remove the needle, and place the syringe in the kidney dish. Lubricate the catheter tip and also place it together with some cotton wool swabs in the kidney dish. Place the sterile drape straight over the pelvic area of the patient. Grasp the penile shaft with the sterile drape with your non-dominant hand. Fully retract the foreskin if the patient is uncircumcised. Fold the rest of the sterile drape over the thighs with your dominant hand and grasp the edge of the drape with your non-dominant hand. Place the kidney dish on the sterile drape. Clean the exposed glans penis with your dominant hand by making use of a circular motion from the base upwards towards the meatus. Use a clean swab each time and discard the used swabs in a waste bin. Lastly, swab the meatus from top to bottom. Hold the penis taut and perpendicular to the plane of body with your non-dominant hand. Inserting the catheter. Insert the catheter through the meatus while avoiding contamination of the catheter at all times. Keep the distal end of the catheter in the kidney dish as far as possible to avoid urine spilling on the bed. Advance the catheter completely up to the level of the balloon inflation port to ensure that the balloon inflates in the bladder. Reduce the foreskin to anatomical position to prevent periphimosis. Securing the catheter and the urine drainage bag. Once the catheter is inserted, inflate the retention balloon with the sterile water. Slowly inject 5 to 30 milliliters of sterile water through the injection port while still holding the catheter in place. Gently pull on the catheter in order to anchor it at the bladder wall. Attach the distal end of the catheter to the urine drainage bag. Make sure the patient is dry. Secure the catheter to the patient's upper medial thigh. And cover the patient with a sheet or blanket. Remove your gloves and dispose of them. Once you have placed the drainage bag on a catheter stand below the level of the bladder, you are done with the procedure. You have successfully completed a male urinary catheterization.